For most of us, mosquitoes are little more than a nuisance. They wreak havoc on outdoor activities, force us to slap on some foul-smelling bug repellent, have us move the food indoors when we want to entertain, and will leave us with an itch and a red welt that, while annoying, will go away in a day or two. No big deal. Fact is, mosquitoes cause more human suffering than any other organism. One sting can inflict humans with everything from malaria to yellow fever to West Nile virus, deliver potentially fatal ailments such as dog heartworm and eastern equine encephalitis to pets and livestock. Over 1 million people around the world die every year from diseases carried by these winged miscreants. And we have seen in the past where the diseases spread so fast, there is often nothing we as humans can do to stop it. Once again, we are faced with a potentially deadly infection carried by mosquitoes. Once isolated to Africa, it is now not only on our doorstep, it's here in America, taking on a new form of transmission that could be the proverbial wildfire spread. We begin with the South Florida incursion and development of Zika, and more with Miranda Kahn.
Thanks, Ed. More than 1,600 cases of the Zika virus have been detected in the U.S., but this is the first time it's been labeled as homegrown, meaning the virus was not contracted through travel or sexual contact.
Sooner or later, it's almost inevitable that we're going to see local transmission of Zika.
We heard the warnings.
Zap Zika by protecting babies and kids from mosquito bites.
Now, the reality.
This morning we learned that 4 people in our state likely have the Zika virus as a result of a mosquito bite.
Today, Governor Rick Scott broke the news no one wanted to hear.
This means Florida has become the first state in our nation to have local transmission of the Zika virus.
According to the governor, the Florida Department of Health believes the virus could be occurring in one small area. That's about 1 square mile in Miami-Dade County, just north of downtown. He says researchers have been testing mosquitoes there for about 2 weeks. And while no mosquito traps have tested positive for the mosquito virus, the Department of Health is aggressively testing people in the affected area to ensure that there are no other cases of this virus. There's just one issue.
The problem with Zika is 80% of the people do not have or show any symptoms.
And that's exactly how it is for the 4 people who tested positive for the virus in Florida. The question now is, will there be more?
I'm almost certain that we're going to see more.
Officials tested 2,300 people in the state so far and are ramping up mosquito control programs. The FDA is also halting blood donations in South Florida until the blood banks can test each unit or until they have the technology that can kill pathogens in the blood. I also want to mention that the Obama administration has requested nearly $2 billion to pay for research, mosquito control, and other prevention methods. Ed, back to you.
All right, thanks, Miranda. It's not as if we haven't been warned about the possibilities of a possible pandemic, not as if we didn't see this coming. So we are once again faced with a simple question about where we go from here and what, if anything, we should have done to prevent coming to this point in time. Let's welcome back to the Hardline infectious disease specialist at Vanderbilt University Medical Center in Nashville, Tennessee, Dr. William Schaffner. Doctor, thanks so much for being here. And there's one thing that comes to mind right away when I hear something like this, and that is, how scared do we need to be?
Well, Ed, I don't think we need to be scared, but we ought to be on the alert. We ought to educate ourselves. So we knew from the beginning that there would be many introductions of Zika into the United States because it was so frequent in the Caribbean and in Central and South America. People from those countries coming here, our folks going there and coming back. And there have been over 1,000 such cases admitted into the United States. But we haven't had spread locally until now via mosquitoes. And of course, if those people come in and they have virus circulating in their bloodstream and they're bitten by our own mosquitoes, then those mosquitoes can transmit the infection to folks who've never left this country. And that's what's happened in a very limited fashion so far. And the health departments are on the case and they're doing their best to make sure that this does not spread.
There's couple things you said in there actually, but when you just said at the last point, they're doing their best. Every time I hear something like that, that makes me think about the money that's necessary. That makes me think about the governmental actions that are necessary in order to make this all work and in order to make sure that we are ahead of diseases such as these. Is it not fair to say that states like Florida can drop $26, $27 million in a shot, but that's almost a Band-Aid? Could not we have done a much better job with this, with other diseases like this, if we had just done the work, the legwork beforehand to get ready?
Well, people have been getting ready, I assure you, but I also assure you that exactly as you suggest, local health departments, state health departments, and the feds also have had their budgets stretched. They've had to rob Peter to pay Paul to get ready for Zika. And I can assure you, every state and local health department in this country has been prepared for Zika introductions, but it has stretched their budgets. And as you said, our Congress hadn't appropriated the money that was requested. So we're doing our best. They're doing very well. But of course, we need to help them financially so that they can do this in a sustained fashion over time.
I remember seeing a couple of movies here in the last few years that have dealt with things like this. I believe one of them was Contact, or Outbreak is the one that I'm thinking of right away. And it, of course, Hollywood scares the living daylights out of us every time something like this comes up. But let's not tamp this down here. We've heard the word pandemic being used now for the last 10, 20 years perhaps, the possibility of it existing because the world is so much smaller these days. Things happen, bugs move, people move so quickly. When you look at something like this and we think of Zika, should we be fearful of a pandemic here? And is this something that could take on really dangerous proportions?
Well, we should be cognizant. And as you suggest, there are many infectious agents out there, whether influenza creating a new pandemic or new emerging viruses such as Zika, chikungunya, dengue, those viruses that could be introduced into the United States. We need a strong public health department, just as we need a strong fire department ready to respond and to also do everything we can to prevent those fires and these pandemics from occurring. Health departments and this sort of public health response doesn't generate a lot of votes, so it often doesn't generate a lot of political attention. But health departments at the local, state, and federal level are our first line of defense and prevention of these sorts of things happening. They're doing a good job, but they need to be supported.
Here's the next line of defense and prevention. Why is there no vaccine?
There's vaccine in the works. No sooner was it shown that Zika was a threat to us than the people in a variety of laboratories, academic and also private laboratories, went to work trying to create vaccines. And we already have, this is lightning speed, 2 vaccines candidates entering clinical trials. So the research laboratories have their lights on at night. People are working on this at max speed.
How scared are you when we look at the Rio Olympic Games and Zika that has come out of that country, that area of the world? We are talking about nearly 500,000 people are going to visit Rio for the Olympic Games, and there is very little medical help there. They're so broke at this point that they have their own people that they can't vaccinate. How scared are you about the fact that people could be coming out of the Olympic Games and this could spark what some people have called a full-blown global health disaster?
Well, it's received a lot of attention. And of course, there is concern, and that's why we're alert to introductions. Fortunately, it's their winter, so it's their low mosquito season. Fortunately, virtually all those people are going to be spending a lot of time at night indoors in air-conditioned environments. So unlike the local population, they won't be as much exposed to mosquitoes. Also, fortunately, everybody who goes there has been educated about using insect repellent constantly. So my fingers are crossed, and furthermore, I would hope that not many, if any, pregnant ladies have gone down there either as participants or, more importantly, as spectators. They should have stayed home, because it's the pregnant ladies, of course, that we're most concerned about, because this Zika virus can get into their developing babies and cause damage.
30 seconds, quick answer from you. Is it not fair to say that the most dangerous word here is complacency?
Oh, for sure. That's why we must be prepared. As you said, the mosquito It's the deadliest animal on the planet.
And I don't think anybody actually knows that, to be very honest with you. I said that to somebody today, and they said, it's a mosquito, for crying out loud. I get a welt, I get a bump, it goes away. I said, do a little research sometime and see, because they actually spread a tremendous amount of disease. It's something we need to watch for, especially in South Florida, tropical places where there's a whole lot of water and a whole lot of mosquitoes and a whole lot of tropics. Let's hope that we have done a little service here tonight, and we have made sure that people are not complacent at this point, and that the government gets on board too. Dr. William Schaffner, I want to thank you so much for your time. We do appreciate that. Now, let's ask another question here. Let's move back to politics. Should you care who the vice presidential candidate is? Come on, be honest. How many of you really remember sometimes who the VP is, even 10 minutes after they're elected? We're going to ask a former vice presidential candidate that question when we come back right here on the fastest 60 minutes of news. Stay with us. The Hardline continues.